when we say disease, there are some diseases which are curable, some which are incurable. Curable diseases, short-term diseases like an infection, we can give an antibiotic and we can, in a few days the patient gets better, the fever settles and they are easy to deal with. I don't think a patient needs to be a winner or we know the disease, because it is short-term disease and is going to be cured. This question arises in terms of long-term diseases like non-communicable diseases like diabetes or hypertension, or even incurable diseases like cancer. That is when we say we can control the symptoms. In diabetes, you can control the sugar levels well, and that will give a good life to the patient, and that way we can say the patient is a winner, because controlling sugar levels needs a lot of personal willpower to stick to a particular diet and be careful with what we eat. So that way patient develops confidence and he can win over the disease well. In a disease like cancer or an incurable disease, if the symptoms are well controlled, the patient is told that his symptoms can be controlled, he can lead a near normal life in spite of having a incurable disease. That way the patient can continue his day-to-day daily activities, and then he can definitely be a winner. Ultimately death is there for everyone, all who are born have to die, but that is inevitable truth of life. So up to then, if the patient is able to maintain himself with good symptom control, I would say that patient is a winner.
Be a winner means to be able to live with the disease and still be productive in whichever ways possible, whatever ways possible. So they have to know about the disease, what the disease is going to cause, what is the prognosis of the disease. This knowledge will help them mentally prepare and to take care of themselves, to take care of the treatment, to take responsibility of their treatment, of the management, and see that the disease progression is slowed, so that they have as many numbers of years much as possible, and not let the disease overtake their lives. So the disease will progress. The patient with cancer will know, okay, he or she is going to live for 5 years or 6 years, but you never know, a person without cancer can die at any moment. We never know tomorrow whether I'm going to be alive or not. Accidents can happen any moment in our lives. So whatever time we have, whether we are suffering from cancer or not, we should be able to use the time productively so that we contribute to the society, make ourselves happier, and live a better quality of life for whatever number of years the patients are going to live. So mentally they have to be strong to deal with the disease, and by that they can be winners even when they are suffering from dangerous diseases like cancer.
Generally, when we talk about chronic conditions like, say for example, malignancies and things like that, often the diagnosis of a malignancy or cancer is accompanied by a variety of psychological reactions in the patient. Some patients may just deny, okay, it's not true, let me get it tested by another doctor. Some people may feel, why me? What have I done to deserve this? I have been such a virtuous person all my life. Some people may link it to some past birth misdeeds, karma, and so on. I think what is important is we have to learn to accept, okay, now we have got this condition, the cognitive strategy of acceptance and remediation. Okay, we have got this condition now, what best can be done about this? Rather than fretting and fuming about what has led to this condition, which anyway is pointless now, because you've got this condition and now you have got to deal with it. I think we have to get into a mental frame where we accept these conditions and think about what best can be done, something like a problem solving. So we think, okay, is it even if it's a cancer, at what stage is it? Is it treatable, or is it too advanced? So there are many cancers which can be diagnosed early, and if we intervene early, we can have better outcomes. Or even if we don't have complete cure, we can at least have a very good quality of life for the remaining part. So I think we need to have a problem solving strategy in place, an acceptance kind of a cognitive strategy in place, and also discuss with the family. When we think about our problems individually, we might lose perspective. But if we talk about it with our family and friends, they will help us to get a balanced view of what's going on, what are the options available, and what best we can do in such situations. And then perhaps taking it step by step will help us to live and fight with the disease better.